Well, we did see in the budget a saving, a significant one that will be achieved, the government says, on the NDIS. So is this a good move and how will it happen? Joining me live is Chief Executive from the Australian Medical Association, Dr. Martin Laverty. Thanks very much for your time. So on the NDIS, there's a big saving in there. What else did we find out in this budget?
Well, people with disabilities and organisations like Aruma who support them should be pretty pleased with last night's budget announcements. There's three areas that we're focused on. The first is the government's targeted measures for cost of living relief. Tripling the bulk billing incentive allows concession card holders a greater chance of seeing a doctor without out-of-pocket costs. That benefits people with disabilities in particular.
Okay, and they're eligible essentially for that.
Indeed.
So that's why that'll help them particularly.
Just as so many people with disabilities are reliant on rental support, so increasing rental allowance by 15% is going to go some way to addressing those inflationary pressures. The second reason that we're pleased is if you look at the specific measures around the NDIS, there's about $1 billion committed to strengthening the oversight of how the NDIS operates. $733 million has been committed over the next 4 years to improving planning, to giving additional staff to the National Disability Insurance Agency. $142 million has been committed over 2 years to strengthening regulation in the sector. Tom, you and I have previously spoken about how important it is that we regulate better those service providers within the market.
That can be doing anything from, I know there's the rare sort of sensational things of crystal hearing, but the more common thing is double charging for a bed, for example. It's like the NDIS tax. As soon as someone mentions the word NDIS, there's almost a new price for it for some providers.
That's right. There's a specific focus on looking at the efficacy. Do the things that the NDIS is paying for actually work? But the third area is we've been given a little bit more insight into how the 8% NDIS price cap is going to work. Over the next 2 years, the budget is not expecting any savings. In 2026, it's expecting to curtail spending by $622 million, and then over the next decade by $57 billion. Now, we still think that's an important but really ambitious target. And I'm saying to the government, why wait 2 years? The NDIS review is already giving us some pointers on how we can bring those costs back in earlier. So we're saying to the government, well done. Across these three measures, people with disability, organisations like Aruma are pretty happy with what we've seen.
So in terms of saying why wait, what would be the reason there? It's just tough news, they want to slowly turn the ship around. Might it be that you sort of have new arrangements around who ends up in the NDIS, whether it's by qualification or otherwise, and you grandfather it, so that's why it's a slow ship to turn around. Do we have any idea how that is still actually achieved, that $50 billion you spoke about?
There's two key reasons why the government is rating. The NDIS review reports in October, the Disability Royal Commission reports in September, and making decisions ahead of that, I think, would be unsound. So very sensibly, government is waiting until Professor Bruce Bonyhady has finished his blueprint. But we've already seen some of those early measures announced in the budget last night. For example, $27 million has been committed to early childhood intervention pilot programs to see if we can find other pathways for kids with autism to not have to enter the scheme.
Where they get good outcomes, but they don't enter what is an expensive scheme.
Which is basically probably in the best interests of the taxpayer, the family and the child themselves.
So given those reviews, look, maybe the next budget could start some savings earlier, but for now they can't start them earlier. Is that a possibility, do you think?
Well, we've said to the government it's very important that we settle who is eligible for the NDIS and what are they entitled to receive and how we improve the participant experience. That's really the focus of the NDIS review, and I think it's fair to wait until October.
Anything missing that stood out to you?
There are. We were expecting to see bolstered training of staff within the NDIS. In the course of this budget, 15% pay increase has been given to the aged care sector. I applaud it, long overdue, it was entirely necessary. But that's now created a bit of a disparity with the care sector generally.
Okay.
And we're working on how we can bolster training opportunities for people in the NDIS to deliver better care, but we're also going to have to tackle wage pressures in the years ahead.
Because they might head to aged care. Martin Laverty from Aruma, thanks for your time today.
Tom, thanks for having me.